Hello students, hello friends. Today I am going to discuss a very important topic that is called hand hygiene, or we can say hand washing, right? Because nowadays the coronavirus and swine flu, there are such pandemic disease that covering all over the world, and that causing so much mortality, that increase the mortality rate in worldwide. So it is to prevent it, the first step we must have to take the hand washing, or we can say hand hygiene. So the hand hygiene or hand washing is defined as cleaning of your hands, to cleaning of it is the art of cleaning of your hand for the purpose of removing the dirt, soil or grease or any kind of microorganism, to avoid pathogenic microorganism transmissions, right? The hand washing with the soap are consistently used throughout the day in certain critical conditions. The certain critical conditions, the more important critical conditions during which we must have to wash our hands, that are first before and after defecation, that are very common. Second one, after changing the child's nappies or diapers. Third one, before feeding to the child. Fourth one, before preparing the food items or handling with the meats or any kind of vegetables. And fifth one, before eating the food habits, right? In the medical practice, the hand hygiene refers to a process of hand washing that comes before every medical procedures. Like if you want to give injections, you must have to have hand hygiene or hand washing. If you want to give do any medical procedure like insertion of catheter, insertion of a Ryle's tube, or insertion of any kind of drainage, you must have to wash your hands before this medical procedure. Or even if you want to touch the patient, if you want to examine the patients, to prevent the disease in such conditions, you must have to wash your hands properly, right? So benefits of this hand washing is, so many disease can be prevented, like coronavirus, influenza, swine flu, infectious causative organism of diarrhea, and also the pneumonia can be worldwide be prevented with the help of simply hand washing and to make a proper hand hygiene, right? In worldwide, if you see, there are because of pneumonia, the pneumonia is one of the acute respiratory infection that causing the worldwide 1.8 million death below the age of 5 years of children uh, in a year per year. And the diarrhea takes a leaves, or we can say due to diarrhea, the death ratio is 3.8 million per year because of diarrhea, in mostly in the children. So this most of the child mortality rates are depend upon these two major disorders, that is pneumonia and diarrhea. So pneumonia and diarrhea, if you who is recommended, if routinely practicing the habits of hand hygiene is maintained, then the ratio of pneumonia and the ratio of diarrhea is decreasing half towards its worldwide occurrence, right? Even the UNICEF recommended the practice of hand hygiene is very better than any kind of vaccines or any kind of medical interventions, right? So it is very helpful to prevent any kind of infectious disorder or any kind of infectious agents, right? Any adverse effect of hand hygiene, or we can say hand washing, is only the simple bad effect or adverse effect of repeated hand hygiene is to simply our hands become dry, our skin become dry, and that can causing sometimes lesion. In obsessive compulsive disorder, the practice of these hand hygiene is very common, right? The material that are used for hand hygiene, or we can say that are used for hand washing, that are soap. You want to If you want to use the soap, you can wash your hand with the soap. right? Antiseptic solution that is called alcohol rub solution that are nowadays very popular, that kills 80 to 90% of the bacteria, and that germs the kill the germs and fungi and viruses. It is very common. This is looks like this sanitizer that we often call as hand sanitizer, right? That is alcohol based solution in which there is a 80 to 90% of the alcohol are in these solutions, right? And third one, lukewarm water. You can even use the lukewarm water. The somewhat bacteria can kill by the lukewarm water, and also the ash or mud. WHO recommended that if there is a no availability of the soap, then you can even use the mud or ash, because when it is mixed with the water, that causes the alkaline solution, and that is kills the germs, bacteria and microorganisms. So if there is no availability of soap, you can simply use the ashes or mud, right? Or we can say sand, right? If you see the history of hand washing, it was the practice of hand washing are first introduced in late 19th century and early in 20th century, that are discovered by the two major persons. First one is by the one of the Hungarian physician, that is called Ignaz Samuel, that are the practicing in Vienna, that is Hungarian physician. And the second one is Florence Nightingale, that is the founder of modern nursing science. These both are pioneers of this hand hygiene and hand washings. uh, Now when you have to wash your hands, it is very uh, as you touch the people, so many people throughout the day, you are touching the so many surfaces, you are touching the so many objects throughout the day, you accumulate so many germs in your hands. So simply you can infect yourself with these germs by touching your nose, your mouth, your skin, and then spread. Also you can spread to the others by shaking your hands. Although it is impossible to keep your hands totally germ free, but with the practice of this hand washing, that can limit the transfer of bacteria, viruses and other microbes. Now always wash your hands before preparing the food or eating, before touching the patient, before treating the wound, before clean aseptic procedure like dressing, like percutaneous injections, before inserting medical devices like Ryle's tube, endotracheal tube, drainage and Vigo insertion. You must have to uh, wash your hands, and after wash then after preparing the food, after using the toilet, after changing the diaper, after touching your pets or your animal, then after touching the animal food items, blowing your nose, coughing, sneezing, handling the garbage, after removal of medical devices like Vigo, drain, catheter, and after touching the patient's surrounding, you must have to wash your hand compulsory, right? Now there is a procedure how to rub or how to wash your hand. First you have to, if you have your hands is not visibly soiled, not dirty, there is no soil visible like this, then you must have to use this hand sanitizer. The adequate amount of hand sanitizer puts in your palm, one side of the palm, and first you have to apply it. First you have to rub your palm with first palm to palm, then right palm on the dorsal side of the left fingers interlag, and then vice versa, right? Then rub your palm to palm with cross finger, right? Then interlock your finger this way, then hold one thumb with warm right palm, left thumb with right palm, and also right thumb with left palm, vice versa. Then the upper part of your finger that are placed forward and backward this way, like vice versa, and finally your wrist, right? And leave it to dry, right? So if you hands are not visibly soiled, then this is the procedure to use these hand rubs for, and the duration is 20 to 30 seconds, right? 20 to 30 seconds. If you have visibly soiled, if your arm is visibly soiled, or we can say become dirty, then you can use the soap, and the duration of using the washing hands with the soap is 40 to 60 seconds, right? So first wet your hands with the water, apply enough soap to cover all hand surfaces, rub, then again rub your hands from palm to palm, rub right palm over the dorsal left dorsum with interlaced finger and vice versa, then palm to palm with finger cross, then back of the finger to opposite palm with finger interlock, right? Then rotation of rubbing left thumb claps in a right palm, vice versa, and rotation rubbing backward and forward with clasped finger, right? And then wash your hands and make it dry with the singly used towels, right? And with the help of towel you can close the tap water, right? So this is the simple procedure of hand washing by soap, right? So thank you very much. This is the very common we can say phenomena to remember this hand washing, that is called apa save anteka, that is આગળ પાછળ sides વેડા અંગૂઠો ટેરવા અને કાંડું. Thank you.